How do you interpret your pap smear results? Imagine sitting in your doctor's office, waiting to hear what your pap smear shows. It's normal to feel a little anxious, but understanding what the results mean can help ease your mind. Your pap smear results are a key part of cervical cancer screening and early detection efforts. They tell your healthcare provider about the health of your cervical cells and whether there's any risk of developing cervical cancer in the future. Most results fall into three main categories: normal, abnormal, and unsatisfactory. If your result is normal, it means no abnormal or precancerous cells were found. This is a good sign, indicating a low risk of cervical cancer at that time. Usually, your doctor will recommend routine screening every 3 years if you are between 21 and 65 years old, unless other risk factors are present. Regular checkups are important because a normal result doesn't completely rule out future issues. If your pap smear shows an abnormal result, it doesn't mean you have cancer. Instead, it indicates changes in cervical cells that need further evaluation. These abnormalities are classified based on their severity. For example, if the report says ascus or atypical squamous cells of undetermined significance, it means some cells look slightly abnormal, often linked to infection with human papillomavirus, or HPV. Your provider might suggest additional testing, like HPV typing, to see if high-risk HPV types are present. A result of LSIL, or low-grade squamous intraepithelial lesion, usually indicates mild abnormalities caused by HPV. These often resolve on their own without treatment, but monitoring is important. If the result is HSIL, or high-grade squamous intraepithelial lesion, it signals more serious precancerous changes that could develop into cancer if left untreated. Your doctor will likely recommend procedures like colposcopy and biopsy to get a closer look. Sometimes, the report might mention ASCH, meaning atypical cells that cannot exclude high-grade lesions, or AGC, which involves abnormal glandular cells that line the cervix or uterus. These findings requiring prompt follow-up to determine if there is any precancer or cancer present. If your sample was inadequate for evaluation, the result is called unsatisfactory. This can happen if there weren't enough cells collected or if contamination occurred. Usually, your healthcare provider will suggest repeating the pap smear to get a clear picture of your cervical health. It's also helpful to know that pap smear results are often reported using the Bethesda system, which standardizes how findings are categorized. Your screening schedule depends on your age, medical history, and previous results. For women aged 21 to 29, annual pap smears are common. For women aged 30 to 65, co-testing with HPV every 5 years or pap smears every 3 years are typical recommendations. Remember, a negative or normal pap smear does not guarantee you won't develop cervical cancer later. That's why regular screening and follow-up are essential. If HPV testing is done alongside the pap smear, it can help identify women at higher risk, especially if high-risk HPV types are detected. In summary, if your pap smear is normal, continue routine screening as advised. If it's abnormal, your healthcare provider will explain what the specific findings mean and suggest the next steps, which might include additional tests or treatments to prevent progression. Always discuss your results thoroughly with your healthcare provider to get personalized advice. Staying informed and proactive is the best way to protect your cervical health and catch any issues early.